that. And now I'm inviting the first startup of MedTech track, Magnus from Latvia. Applause. Here's your timer will be on the screen.
Good afternoon. Magnus is a medical technology company that has set a goal of accelerating magnetic resonance imaging with the help of artificial intelligence. This is magnetic resonance machine. This is one of the safest and one of the most precise diagnostic tools ever used in healthcare. However, the widespread use of this technology is very limited because there are only 19 machines per 1 million of population in Europe. And if we take a look, the maintenance cost of a single MRI can be as high as $120,000. If we sum up all of those costs, it may seem that the high prices charged per patients are insufficient in the market. We at Magnus believe that the healthcare should be accessible, so we have set a goal of changing the current MRI market. We offer a unique and innovative approach of connecting magnetic resonance machine directly to the cloud. While the patient is lying still inside the machine, we are sending the analogous data from MRI machine to our servers, where artificial intelligence technology reconstructs the image to obtain the full picture. As a result of these manipulations, we are able to reduce the time which it takes per the single MRI scan to twofold, which means that previously the scan took 60 minutes and now it's only 30, which is a groundbreaking in this industry. So for the single hospital, this is the cost-benefit analysis. We are able to free up to 1.3 thousand of MRI hours yearly. As well, hospitals don't need any more expensive on-site clusters which they use for MRI image reconstructions. Our tool is equipped with automated diagnostics, which means that the doctor, with a single click, could identify the disease in the pile of MRI images. So no more scrolling with hands. We just click a single button and we find the disease. Later, the doctor is notified what could be the potential diagnosis and how to treat the patient. Our tool is designed especially for radiologists and healthcare professionals who work directly with MRI images, because it will assist their daily routine and it will free up more time to work with their patients. We are supporting every algorithm we use with the extensive scientific research. On the 15th of March 2020, we are presenting our new paper, which is aimed to support the algorithms run at Magnus. Artificial intelligence, sooner or later, will make its way into healthcare. The question is where you are going to be leading the crowd. And therefore, I'm facilitating you to go to magnus.com and enjoy the future of medtech. Thank you very much for your attention.
Thank you. All right, we still have time. Questions from the jury. Who has the mic? Okay.
I can start. Great presentation. A few questions. How do you work with false positives and false negatives?
Well, it's actually a very tricky question. And once we were building this application, this was the first which popped up in our mind. So we have created the model, which actually analyzes the false positive and false negative pictures, so that we are continuously updating our database in order to reduce the number of false positive and false negative numbers. That's what we do. So we first started with the binomial model. Then we received a particular number and it was really devastating. Then we updated our model from the binomial. We added more numbers into it. There were more pictures. There were more layers in the convolutional neural networks. We updated this number. And so it keeps rising and rising. So far, this quality reaches 70 or 80%. But we believe that in the future, this number could be more improved, because we are adding more pictures, and therefore this false negative and false positive number keeps reducing as we add layers to CNN.
Do we have another question? That will be the last one.
So where are you planning to start this one? So you have a brain cancer there. Normally it takes a lot to teach the algorithm for different diseases or different symptoms.
So far, as you have seen, we have started with the brain tumors, because these are easily to identify. Next, we will start with some hemorrhagia, for example, insult patients and any others. Then we have plans for treating the anatomy anomalies. These are the free diseases we'll be tackling in the first edition of this application. later we will add gliomas and other types of neurological diseases. But this will be more complex to add, so we require time in order to deliver the results which could be used in the healthcare, so that the patient receives the diagnosis which is accurate. Yeah.
All right, thank you. Thank you for this one. And the next, yeah, thanks applause. And the next startup is NurseBeam from Estonia. Do we have an Estonian crowd here? Give him a cheer.
Hey, I'm Timo from NurseBeam, and I have a question for you. Who here loves to be sick? Any fans of diarrhea? No? Well, NurseBeam is here to take care. And we are focusing what happens when you are getting sick abroad, because worse than being sick at home is getting sick abroad. I have been personally through this in 9 different countries, and finally I was so fed up that I wanted to have a change. And this also is painful for insurers, like travel insurers. They have to pay $14 billion each year in claims. And most support you get is fill up the claim form. But you want something more. You want to get actually pointed what to do, like what drug you need to use, where to find it, and how to use it, for example, when you get food poisoning in Beijing. And the reason why the insurers would be interested in a startup is that not only we offer a superior experience for the policyholders, but it's also up to 200 times cheaper. So that's the reason why to mingle. And just 1 year into operations, we have got blessings from EIT Health, WHO, partnered with the leading insurers in Asia Pacific, currently working with Plug and Play to take it on the Japanese market ahead of Tokyo Olympics. And that all with just a team of 4. We are combining the best of Europe and Asia. With Andra, we did the best Asia-Europe Foundation project 8 years ago here in Estonia, and moving forward. But to get us truly global and cover all the 241 territories out there, we are doing a seed round currently through the Angel Hub in Hong Kong, aiming at least 1 million, and you can be part of that journey. And this also includes getting full certification from both the European and American drug authorities. So in a nutshell, if you want to get peace of mind next time you're on a trip, ask your travel insurer to onboard NurseBeam. This also brings them smaller claims, and in case you are an investor, you would get return of the investment in the future. The best thing is to try it out yourself. You can go to nursebeam.app/start to see what's the experience you would get through us in Singapore, Hong Kong, and Sydney. Thank you. I'm Timo, and this is NurseBeam.
Thank you, Timo. All right, so questions from the jury?
What's your competition?
The competition currently for the medical assistants, actually you have call centers, but they focus on the low frequency, high value claims. If you look into high frequency, low value claims that make actually 80% of the travel insurance claims, there isn't really existing competition apart that you have to figure out yourself and take the paper from the local clinic you found through a Google map or something to your insurance company. And this is something that the insurance companies we have been talking so far, they have got super excited. Some of them have been looking something for this already 5 years and they never found. So we are really happy to serve that.
Okay, we have one more question. Time for one more question.
So what is your current revenue and how much of revenue do you plan to achieve by the end of this year?
Thanks for the question. So we are subscription-based, and it depends the number of policyholders and the support they want to provide. So for example, the digital nomad insurers, it starts less than €1 per policyholders. The ones who want to have like longer integration, we can charge more. Considering there are 1.6 billion travelers globally, you can do the math inside.
All right. Thank you
Thank
very
you.
much. I'll take
Here
the
you go.
clicker. Thank you. Applause. Applause for NurseBeam, and Casper from Latvia is coming up next. Give some energy to that as well. Applause.
Last year in Latvia, 1 out of 20 fracture cases were handled by Casper. My name is Gins, and I'm from Casper. Today we live in the golden age of technology, but sadly, fracture treatment is still in the dark ages, because most of these injuries are still being treated with this big, heavy, and uncomfortable plaster cast. Well, enter Casper, a lightweight, waterproof, 3D printed cast that is custom made for each patient. This is how it works for you. You go to a doctor, he takes a quick 1-minute scan of your fracture. The scan gets sent back to us, and we get to work. After 5 days' time, a 3D printed cast is delivered to you, ready for use. Now this is how it works for us. Hospitals pay us per cast. And our patients are loving us. Last year, we were able to help about 300 people and make Casper available through all the major cities right here in Latvia. But this year, we have already had our first cases in the UK as well. Why UK? Because out of 6 million fracture injuries that happen in Europe almost every year, 800,000 of those are right in the UK. Our goal within the next 3 years is to service at least 10% of these UK cases. Of course, none of this would be possible without a team full of passionate people. Our team consists of specialists from business, healthcare, and technology. And without them, we wouldn't be where we are today. But even that is just the beginning for us, because, as we all know, not only humans break their bones, such a thing could happen to our 4-legged friends as well. We have already had our first animal patients. We could apply our system easily enough to take on cases even such as these. So, in conclusion, if there is one thing I would like for you to remember, is that if you have a friend, tell them about Casper. If you know somebody using a plaster cast, tell them about Casper. And if you know a doctor, please tell them about Casper. And together we can finally change fracture treatment for good. My name is Gins, and I'm from Casper. Thank you.
Thank you. So, time for questions. Jury?
Do you have any hospitals already that you work with in the UK, or the model that you would be going there for?
Yes, we have one clinic in London that we are currently working with as of start of this year.
Have you thought about model of like licensing the 3D printing to hospitals? So think about the scalability. So it doesn't make sense that you serve and make the 3D printing yourself and take 3 days. It could be 3 hours in the hospital.
Excuse me?
Just understanding like why you want to be in service business. Could you actually license the printing to hospitals that they would have your 3D printers and they will do the, instead of 3 days delivery time, it will be 3 hours for the patients?
Yes, so the benefit from that is that this process works like this. We give the hospitals the scanners. They take the scan of the fracture, and for the hospitals, the plus side is that they can save up to 15% of staff time, and the doctors themselves can take on additional fees for their consultation. And we don't take subscription-based, we don't take monthly fees from them because well, they didn't want to pay if there were no casts produced. So our agreement was that as soon as there is a cast made, then that fee is sent to us.
I think, yeah. Did that answer your question? We have, no, we don't have time for more questions, but yeah, thank you.
Thank you.
So next up is Vico from Latvia. Welcome, Vico.
Hi everyone. My name is Yanis. I'm a medical doctor myself and the co-founder of Vico. So, stroke. Some of you may know it's a very common and very devastating disease. It turns people into disabled in a matter of minutes. The process of getting back to normal is called rehabilitation, but it requires a tremendous amount of human resources, and medical human resources, which are in lack everywhere. There are 2 billion people in countries like India and Southeast Asia with no access or very little access to healthcare. No surprise, stroke incidence is among the highest in the world in these countries. So there is no rehab for these people, no rehab at all for most of these people. So therefore, only less than 10% recover to their full potential. Others have to rely on society, which creates huge burden on society. There is no one to lead this process for these people. Imagine family, someone has a stroke. What do we do? What do we do to prevent stroke? What do we do to recover stroke? There is no one to say. So it's time for technology to change this. Meet Vico. Vico is a digital rehab therapist which provides comprehensive, personalized, on-demand treatment for way cheaper to what's currently available. You may guess, how does it work? Vico is a digitalized version of established, proven rehab techniques that represent a golden standard of stroke care. It has 3 domains, which are physical therapy, cognitive behavioral therapy, and patient education. Basically, all the main things that patients need. It lives on your mobile device. So our current status is the following. We are running a pilot trial in Latvia now. Early results are really promising. We are developing Vico in partnership with National Rehab Center of Latvia. We are accelerated by Acceleraze and CR. We are preparing for a clinical trial to get evidence that it works. So our business model is B2C subscription-based. Value per subscription is €10 per month, 3 to 6 month long program for each patient. We target 50% of the market in these countries, which means that around 2 million people per year. So our next milestones are CE certification later this year, entering Latvian market later this year, and entering Indian market in the beginning of the next year. So we have a great and driven team to execute our plans and high-level advisory board. We are currently raising 300K to finalize pre-seed round, which will be used to expand our team, initiate clinical trial, and enter India market. Thank you very much.
Thank you. All right, questions from the jury?
What is competitive landscape and what makes you better compared to competitors?
Yeah, thank you. Great question. There are a couple of solutions focusing on one or the other aspect of stroke rehabilitation. For example, there are solutions that are focusing on aphasia or focusing on just physical rehabilitation. We are kind of covering the wider broad of the problems, like physical problems and cognitive problems in total. So there are some competitors that are really focusing on something more narrow than us.
A small question still? Yep.
There are some competitors on the rehab market too, but they address the same problem too. But what about the motivation and engagement of a patient over the process?
So yeah, this is a great question. So the lack of motivation and depression is the tremendous problem in these patients. So that's why we use the cognitive behavioral therapy, which is built in our solution, which is a standardized psychotherapy, which helps to get over the depression and lack of motivation.
All right, thank you.
Thank you very much.
I'll take that. Okay, next startup coming up is Keepus from Finland. And the lady, please give her a warm welcome. There you go.
So maybe you've been to a hospital. You know, they hook you up to those large patient monitors. Then they might ask you to rate your pain level on a scale from 1 to 10. Quite subjective, if you ask me. And eventually, they send you home, and you're left in the dark about your health and your recovery. But what if I told you this small device does the same as those big hospital monitors, but more? It doesn't measure 2 or 3 vitals, it measures 9. And what makes Keepus so extraordinary, that it's the only device that can objectively measure pain for babies and children, because they can't express their pain level. So you might be thinking, aren't there already solutions that make patient monitors? Yes. But none of their solutions are extensive as Keepus. They monitor 3 or 4 vitals, but their solutions are not wireless nor this small. Their solutions are only for hospitals. Meanwhile, we target hospitals and home users. So hospitals can now monitor patients remotely. Patients don't even have to go to the hospital to get a checkup. Also, home users can now monitor their own or their loved one's health remotely. So we sell the device, as well as the EGC pad that you use to connect it to the skin. And then we sell our Keepus data, which is very valuable to insurance companies and for pharmaceutical companies, because pharmaceutical companies want to know how the drug is affecting the body and whether it's promoting recovery. And that's exactly what Keepus tells you. So you love numbers. So here you can see the potential growth for the upcoming years. But let's not get into the future. Let's focus on now. This year, we got a $2 million order from Pakistan's government. And that really opened our eyes to the emerging markets of developing countries that are trying to improve their healthcare system. 3 weeks ago, our team went to Pakistan, and they found out their hospitals and ambulances have essentially no monitoring equipment other than a thermometer. Think about that. So Keepus is the perfect solution for countries that are trying to improve their healthcare system, and it is the most affordable solution on the market. All of this is possible because of our brilliant team. So our CEO has 20 years experience in business, and that's why he recruited a highly motivated, international and skillful team, the best of the best, may I say, as well as a wonderful advisor board of medical, business and technical advisors, one of them being the world's leading pain researcher. So it's truly down to our amazing team. So before you say thank you next, let's change the world's healthcare system with Keepus. Thank you.
Thank you so much. Questions from the jury, please. Thomas is ready to ask. Yep.
So how accurate is the level of pain that you have been now researching? So how is that validated, clinical trials or anything on that side?
Great question, thank you. So currently we are going through clinical trials as well as CE approval. So they're ongoing and we're doing all that we can to achieve the best accuracy.
Another question?
Yes. Are there any barriers to entry for other competitors doing this? Is there any proprietary data or something in your product or device?
So we do have a patent to protect our technology. So it is unable for competitors to basically do the pain monitoring that we do. The patient monitoring of like the vitals other companies can do, but we've kind of gained the first mover advantage in the sense that we have the most versatile, extensive amount of vitals that we measure, and then since our product is wireless and meant for both hospital and medical use. So we clearly have a first mover advantage.
All right, thank you. I was dreaming of this kind of product a couple of years ago, and now it's here. It's amazing. Thank you very much.
Thank you so much.
All right, so next come is Šeši partnerai. Yeah. Braja Dose from Lithuania. And another lady, please give her a welcome applause. This one. There you go.
So hi, my name is Riga. I'm a CEO and a co-founder of Braja Dose, and today I'm so excited to represent you. The tool which will help oncology doctors to save the cancer patients' lives. I've been working as a medical device engineer and medical physicist for more than 7 years. And I've seen many of oncology doctors unsatisfied, failed, totally lost. So these brave soldiers and heroes fighting hard in the front of a cancer treatment, carrying more than 200 million cancer patients worldwide, are simply lack of accurate and personalized cancer treatment quality control tools. So that's why we made Braja. It's a hardware, it's in the shape of flexible tube, and actually it measures the radiation dose during the radiotherapy procedure. So this is the procedure where the radiation kills the cancer cells. So it works in very simple 3 steps. First, we insert our flexible tube near the tumor before the procedure. During the whole of procedure, it collects the radiation data and sends it immediately to a doctor's computer. So this data is essential for a doctor to increase the treatment plan significantly and finally reduce the full treatment cost. So we are 3 times more accurate than computer modeling systems, which is used at the hospitals these days. So we are highly compatible with standard medical devices. And most importantly, we are personalized. So since it's made of 2 separate parts, we are planning to sell our dose measurement tool and data management system for hospitals and also provide them with an annual service. So our market opportunity here is driven by enormous number of cancer patients and increasing number of radiotherapy procedures. It's increasing by 15% every year. So we are planning to start from the Baltics, scale to Western Europe and to United States. So we started our journey simply as all startups from a project of Horizon 2020. So we were in a cooperation with a university, and we were supported by EIT Health InnoStars last year. And for now, we have a tested prototype, which is under preclinical trials in Lithuania at the National Cancer Institute. So this is fancy, but still some miles to go. So we will finish the clinical trials in upcoming years, and we are planning to launch the market by 2024. So this is us. We are medical device engineers and oncologists working together for more than 10 years and willing to bring this nasty plan to life. And we are so excited to be supported by famous academics, cancer researchers, and mentoring service. So for a clinical validation, we will be supported by EIT Health by $500,000, but we're still looking support for market validation. So we invite you to join us because we are Braja. We strongly believe that medical doctors should be failed no more. So join us. I'm Neringa from Braja.
Oh, thank you very much. All right. So we have some questions from the jury.
What evidence do you have that your methodology improves quality of treatment?
So we tried our prototype at the National Cancer Institute with our first adapters, the most famous Lithuanian doctors in cancer treatment.
Another question there?
And have you tried it outside of Lithuania?
So we are trying to do it now. Actually, we're preparing this $500,000 project to test our device in France, Estonia, and Germany. So we'll do it quite soon.
And last small question?
Yeah, this is great. One question, how big is this use case?
You mean?
How big is the market for this?
You mean for radiotherapy?
Yeah, this specific treatment. Have you thought about that?
For this specific treatment, it's up to 2 billion euros market.
All right. Thank you very much.
Thank you.
I'll take this one. Thank you. Give an applause. And the next one is Longenesis Limited, all the way from Hong Kong. Welcome. Yep, that one will bring you forward.
Good afternoon, ladies and gentlemen. You have every right to be suspicious. I don't look anything like a Hong Kong resident, but bear with me. So Longenesis is an extendable platform for unprecedented clinical data and patient access. Now, our vision is very simple. We want to unlock the power of personalized clinical data in drug discovery studies and patient recruitment, as well as enable hospitals to share their data as clinical assets with third parties, such as pharmaceutical companies. Now, believe it or not, clinical data is actually for sale, and it is a 60 billion market. The problem is it is only being sold anonymously now, so you cannot sell personalized data. It's not legal without consent. If you equip it with consent, it's a 250 billion market globally. That's quite a number. So why can we share personalized data all in all? 4 problems we have identified, right? So traceability, how do you trace it back to patients? Transferability, valuation, how much does it cost at the end of the day? And then consent, how do you record and transfer patient consent for data sharing from one party to another? Now, what we have built is our headliner product, which is Longenesis Proteus, and it is basically a huge, we call it a marketplace, it is a huge dashboard in which we feed anonymized metadata metrics from the hospitals Longenesis works with. Now, from the other end, we feed pharmaceutical companies that are able to query through the anonymized metadata metrics and request these data sets straight from the hospitals. Now, what happens next is we prepare hospitals to actually execute this procedure of sharing by supplying them with our own custom-built tools for consent management and patient interaction. Now, we charge them both ways. We charge pharma for access, and we charge hospitals on commission basis when they sell data, as well as SaaS for consent management toolkit that Longenesis provides. So we earn twice, or even 3 times sometimes. Now, how much is the data? So if you take a hypothetical number of 100 type 1 diabetes patients available with every hospital, and you sell this cohort without Longenesis tools in an anonymized way, it's around $6K US. Now, if you actually supply it with consent and patient reach, it is suddenly 100K sold to a, let's say, Roche or AstraZeneca of the world. Now, we've been through all around the world, Europe, Asia, Middle East, and US. We have traction with all the major players there, private hospital chains, genome sequencers, biobanks, and our patient reach and data reach is now over 10 million data items. We're now raising around 1.5 million. We've been self-funded so far, 700K to date in self-funding, and we need to expand, so we're raising an external round. We're pre-booked with revenue at 250K only this quarter. Our team is 100 years of experience in medtech and pharma, and we're also supported by Bitfury and Insilico Medicine, much larger entities than ours. You can read up on us. We are all over the press. On this note, thank you very much, and I'll be glad to answer your questions. Thanks a lot.
Thank you so much. And the questions from the jury, please. Who's the first to ask?
So how do you prevent reselling the data, or have you thought of the other markets that actually might be a bit larger than healthcare?
How do we prevent what exactly?
Well, you know, if Roche would have personalized data,
yeah,
you can sell it to Aon or the other insurers companies that
right.
Might benefit in some cases more than Roche.
So we started off with the obvious fit, which was pharma. Pharma uses that for preclinical validation if we're talking about data sets, and they use it for prospective data generation events if we're talking about access to patient cohorts, as well as patient recruitment, right? So we focus on very specific diseases. So we focus around oncology, central nervous system, and type 1 diabetes. So these are the major expense categories for pharma. Insurance companies are not yet there. It's a misconception that they're using a lot of healthcare data to actually tailor fit their policies. I mean, we've talked with all the major ones in Europe and US. They are still exploring it. They're not buying data. Pharmaceutical companies do buy data all the time.
How do you manage the problem of consent? I mean, hospitals don't have, consent of patients.
Right. So what we do is we supply hospitals with our own toolkit for how you digitally record and streamline consent management. This toolkit basically allows you to automatically comply to the applicable generation in the region, so HIPAA in US, GDPR in Europe, PIPA in Korea, whatever. And hospitals use this. It can be a web platform. We connect them through our API. It can be a web platform. It can be their own app in which we integrate. And they can ping patients directly. They can provide them with relevant consent forms, with relevant nationally specific identification mechanisms, etc. So let's say we're now doing a project, preparing to do a project in Emirates for the National Genome Incentive, and there they have Emirates ID, right? So we have integrated with Emirates ID, and people authenticate with that.
All right, thank you very much.
Thank you
Time's
so much.
up, and we have to welcome the next contestant, and it's Legends from Lithuania. Welcome. Welcome applause, please. The green button.
Cardiovascular problems cause roughly a half of all disease-caused deaths worldwide. However, many of these can be prevented with timely diagnosis. Now, you may know that your physician might use one of these to inspect your heart, but actually these are just not enough. And in most cases, your physician would jump on an ultrasound machine to perform an ultrasound examination of your heart, meaning that he or she places a probe on your chest in various different angles to obtain two-dimensional images of your heart on a display of an ultrasound machine. Now, the problem is that it's mostly manual work, and you have to have a lot of skills and expertise to perform and to get accurate results. As a result, patients all across the European Union are waiting 5 weeks to get admitted to a hospital for this examination. And the reason behind this is that the physician must perform all of these tiny measurements when performing the examination to be accurate enough. Now, we use deep learning algorithms to produce a software that is capable of automatically detecting heart's anatomical features and evaluate its function, meaning that whenever you get your ultrasound done, the images move to our cloud server, and then our neural networks just simply spit out a report for your physician for final validation. This allows us to reduce the average examination time, we increase its accuracy, and most importantly, we offer our customers up to 38% revenue increase. Now, we plan to integrate our software into picture archiving and communicating systems. Those are universal systems used by hospitals to store, share, view their medical images at any given time. This will give us a large network of hospitals using these systems, and which will be much more easier to reach our end customers. None of our competitors are doing the full heart ultrasound examination protocol I've covered before. We are running multi-center clinical trials in several hospitals in the European Union, and the same channels, same digital channels that we open now will be used to simply roll out new products in the future. Currently, we are closing our pre-seed funding. We will shortly start an MDR assessment of our medical device, and parallelly, we are integrating ourselves into different PAC system providers to give us an access to more than 6,000 hospitals globally. Now, this guy is a medical doctor in cardiology, and he does this examination daily, so now he knows what's up. This guy has 4 years of experience in deep learning. I just talk a lot, and this guy is a full-stack software developer. Our professional advisor is a well-known cardiologist from the largest hospital in the Baltic states. Another one is an ultrasound researcher from Kaunas University of Technology. Now, we've been in business since 2019, just last year, and I find it quite hard to fit all of our achievements in one slide, but the most important one is that we won first place in Pioneer Silicon Valley competition last year. So thank you very much for your attention. Please make sure you scan the QR code. Thank you.
Thank you. Questions from the jury, please? Who has a question? Thomas? Yeah.
Yeah, so the devices that MDs are using for the scanning, so like, if I understood you are doing only software, right?
Yes, software
Yeah, so
only.
like, are you supporting all the different devices, or is there some specific
Yes, it will be
needs?
running in a cloud service. So a physician transfers your medical images, your heart's ultrasounds to his or her working place, and then it's all in the cloud. So the computation is made in the cloud. So it's vendor agnostic. It doesn't make any difference.
In case hospital is using one of
Yeah,
HR
Siemens,
systems,
Philips,
yeah,
doesn't matter.
or they're using, I don't know, Cerner, Epic, or the other healthcare systems, would you be planning at least to be compatible with those?
We're not planning to compete with ultrasound producers.
No, compatible, kind of integratable, work together with those systems?
Yeah,
so
you're
to
talking
become
about real-time
Yeah.
processing. No, we're doing post-processing because it's what the world is moving forward, actually.
Okay. Thank you
All
very
right.
much.
Thank you very much.
Thanks you. And the next one, last before the last, is Verasel from Latvia. Welcome, Verasel.
Hi, I'm Arseny from Verasel. We're in the game of regenerating human body, a rapidly growing playground of the future. Our product is a cheat code to win that game. It'll become a tool for surgeons and patients worldwide to win that game and will grow in value over 40 times within the next 5 years. In any game, your character defines how you use your tool. Are you an altruist, a perfectionist, or a futurist? For us, the altruist character was the closest, so we're creating this package first. We just had to replace the outdated tool for treating burns, which is lengthy, risky, and painful for patients, and very expensive for healthcare system. So instead of skin transplantation, we created a kit for extracting skin cells from healthy tissue. You can imagine an iPad box, which has some basic medical tools to be used in a specific way right in the operating theater. The surgeon just extracts a lot of skin cells from a small sample of patient's skin and applies them in a mixture in a liquid solution onto the wound to heal. This accelerates healing, minimizes scarring, and reduces costs of treatment around 20% and even more. The leading surgeons in Europe have said they need this. We have the support and actually advisory of the president of European Burns Association. What's more, we are in talks about cooperation with a leading European research institution on advancing our product and tapping not just burns market, but also the huge complex wounds market, chronic wounds, etc. We are the first ones to provide 3 times more cells, the building material for the skin. We're the first one to really bring it to the operating room and really adapt it to the needs of the surgeons in the operating room. In fact, it is so versatile, it can be adapted to all the goals of all 3 characters with just one tool. Here's our game plan. We're a year till the market authorization in the EU. Another year till first sales. We already have first commitments for pilot studies with patients and we'll start selling in parallel for burn uses. We're planning to get reimbursed in Germany, France, and the UK by 2024 and get first sales in the US and Asia. And by 2026, we're aiming to get more than 200 million revenue in EU alone. That's 5% of all the procedures we can help. There's huge room to grow. Getting to the top level of the game requires a boost. For us, that's 3 million euros to get the first sales in Europe. Whatever the character you pick, we know all 3 live in all of you. Let's talk about how we can help patients heal better, heal faster, look better, and feel better. Let's press play. Thank you.
Thank you. Questions from the jury?
How do you compare to competitors in terms of price and quality of treatment?
Right. We have 2 amazing competitors. Have been pretty long on the market. One is bringing cell isolation to the operating room, but they don't provide the consistency the surgeons want. The other one, they are amazing at effectiveness. The only thing they need a lab. They can't bring it to the operating room. We're combining the advantages of both of those competitors, and we provide 3 times more cells and at a lower price. So we're looking at a reference price of €1,000 per similar kit. We want to drive this down because surgeons said they aren't willing to pay for what's there on the market, €1,000. They want something more affordable and still more effective. We're doing just that.
Do we have another small question from the jury? Yeah, one more question.
When you're entering the market with burn, is there certain restrictions how large of an area you can cover, or have you tried that it's precise, or think about if somebody has severe burns?
Right. Based on the existing studies, we can heal at least ratio of 1 to 5. So we can get 2 by 2 centimeters squared of the sample, and we heal 5 times more area. The thing is, they can potentially go up to 40 times area. So that's our vision. We want to heal as much as we can, almost the whole body, from a tiny piece, a button-sized piece of skin.
All right, thank you very much.
Thank you.
And we have the last startup of this track, Lucero Bio. Yeah, coming from Sweden. Give it a round of applause.
Hi, my name is Rich, and I'm the co-founder of Lucero. And we're trying to simplify the manipulation of single cells, and our goal is to help the global healthcare to transition to personalized medicine. So today, if you're diagnosed with the same disease, you're likely to receive the same generic treatment. And this is a problem because every disease is different within a single cell level. So the treatment that worked for you might not work for the other. That's why the future of healthcare is moving towards personalized treatments. But in order to get there, we need better tools that allow us to study these single cell differences. And there's where we come in. The problem is the current tools are either expensive, they're rough on cells, which can alter the results, or they're labor intensive. So we want to solve those problems. Our solution comprises 3 core technologies: optical tweezers, microfluidic chips, and an AI-powered software. It will be a system that can, it's a plug-and-play system that can be used in any inverted microscope. It will allow you to precisely and gently select the cells you want, and it will be completely automated. The single-cell multi-omics market is young, but it's growing quite fast. And we're targeting specifically the single-cell isolation segment. We're a really young startup, but we have been up and running for 5 months, but we have already received grants from the Swedish government. We have secured our first user, and we have filed our first patent. We have also won some awards, and we have traction within Sweden and internationally. Our next steps include we're currently in talks with AstraZeneca for our first pilot project in Gothenburg. We are starting the prototype development at the beginning of the summer, and we hope to have an alpha version at the end of the year. Our most important asset is our team. We have a great combination between business and technical skills. We have also the fortune to work as an advisor with Dr. Giovanni Volpe, one of the world-leading experts within optical tweezers, and as a key collaborator, Dr. Velkenhusen, who will be our first user within his cell lineage research. So we're Lucero. We're hoping to have a pre-seed round the next year and looking for investors who might to join our venture. So we're simplifying the way to manipulate single cells, and we try to bring the future of healthcare towards personalized medicine. Thank you very much.
And thank you. And now we're ready for the questions.
Can you tell me more about the business model that is behind?
Sure. So our business model includes 3 ways of revenue. First, we're selling the optical box that we connected to the microscope. Then we have recurrent revenue within the chips, who will be when every time they're performing their experiments, the single cell experiments, they will need one, and the software, which is a license. So that's the business model.
Do we have another question from the jury? If not, then thank you. Thank you very much. And this is the end of the MedTech track.